Welcome to another production by the Millennial Mechanical Therapist. Your hosts, Dr. Joseph Gravino and Dr. Clay Case, are two physical therapists trying to treat health issues mechanically. Listen further for patient cases, guest videos, advantages and disadvantages of the way they practice, and much more. Thanks for tuning in today. Check us out on YouTube, Facebook, and at our website. We hope that you learn a lot from watching this video and you come back for more.
Hello everybody, I am the Millennial Mechanical Therapist, and today I have a very interesting case for you. So, this is going to be a little different than some of the cases that you've heard me talk about before. This is in a joint that's not in the spine, nor, I guess, in the extremities, but isn't one that, people readily remember, readily think about MDT or mechanical diagnosis and therapy with this joint. And today we're going to talk about the TMJ. So I had a patient who I've been previously seeing for cervical radiculopathy, beautifully responded to retraction, extension, blah, 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 blah. So she's also been dealing with some ear pain that she spoke to me about it before, but to make a long story short, it was never influenced by the neck, and she had a physician as well as an ENT who she was going to, and they both believed that it was, I believe it was mastoiditis. And she was undergoing MRIs, CT scans, and x-rays to see if there was anything, I guess, there. So I ignored the symptoms, and, randomly I would ask her about them, and she always said that they were unchanging, that it was painful, but that nothing that we were doing was truly influencing it. So I chalked it up to something that was non-mechanical. And I guess I did her a disservice for about a month by not really seeing if I could influence it, but she really didn't seem interested in seeing if I could influence it either. So unfortunately, I don't have a McKenzie sheet that I can tag along onto this, or that I can upload with this video, because on a fly one day when we were going through recovery of function for her neck, she asked me about her ear pain. And she said that her physician and the ENT were under the impression that it wasn't mastoiditis, and that they threw some different differential diagnoses out there and said that it could be TMJ and that she might want to see a dentist. She asked me if that was something that I treat. And, when people ask me if I treat TMJ, I usually give them some spiel about how there's physical therapists out there that are specialized in treating the TMJ, how I am not one of them, how it's not really an area that I like to focus on, or not really an area that I pride myself on being good with. I did say that I treat the TMJ like any other joint. I assess it with mechanical diagnosis and therapy to see if it's truly mechanical, or if I can, find out what type of classification it could fall into. But, I'm not a really big fan of, going in there, hooking it on the jaw, and I'm not a big fan of doing all that type of stuff. It's just me. If you find good results with it, continue on, please. I just, when I was in school and when I've gone to some manual therapy courses afterwards, I really didn't like people's hands in my mouth, nor did I like putting my hands in people's mouths. So, again, this is not to tell you what you're doing wrong. This is not to tell you that manual therapy of the TMJ is ineffective or isn't good. Trust me, I know plenty of clinicians out there that go in there and do a lot of awesome manual work inside the jaw, outside the jaw, and they kick butt. I don't want to say anything ill words with them. As long as you're getting your patients better, that's all that matters to me. But this isn't interesting. I've dabbled with a few TMJs with MDT. A few of them have responded. A few of them have not. I'm going to tell you today about one that did respond. So she asked me, she said she was feeling good. We were nearing the end of recovery of function. And she asked me if I could look at her jaw. So I said, sure, why not? After I gave her my spiel, she was still down. So I said, okay. So we go through, and really the big, she had unilateral, one side pain that was kind of in her ear and in the jaw, or the TMJ type area. Didn't come up into the temporal area, didn't, see back into the headache area. I've been playing with her neck for a long time, and she said that nothing that we've done in the neck has influenced it. To make sure, I did a lot of overpressures into retraction, flexion. Nothing seemed to bother her. Rotation wasn't even an increase increase no worse, or decrease, but nothing. Didn't even influence it. So measurements, she was equal bilaterally to lateral deviation. She really didn't have any type of S or C curve in opening, but she was very limited in opening. And I really didn't go into how many millimeters, but I do the old 3-finger trick, and she couldn't open past 1.5 of my fingers. So that's to me that was a significant loss in opening. She reported no history of TMJ issues, no history of anything, and her only real complaint was pain with yawning and with chewing gum or chewy structures like beef or a steak. So I went through protrusion of the jaw, and we just kept getting increase no worse, increase no worse, increase no worse. We probably went to about 30 of them when I abandoned protrusion. We went to retraction, and retraction I got increase no worse for a while until I actually made it worse. So I stopped retraction and then went to just pure opening. And I got increase no worse, increase no worse, increase no worse. And I've seen a similar presentation before. So what I did was I combined retraction of the jaw with opening. So they actually retract and then open from the retracted position. In my mind, it's kind of synonymous to a retract of the neck and extend from the retracted position. So initially it was painful, but it got better as the repetition came on, and it decreased what she was feeling with opening, the pain that she was feeling with opening. So I had her apply overpressure at the very end of opening. So her movement was retraction, opening, and then overpressure at the end. So I'm going to demonstrate it for you. So it's retraction, pressure into opening. 10 of those abolish the pain that we made worse, and that apparently has been there for a long time. So, I said, let's see how it goes. Her opening range of motion was now a full 3 fingers. Nuts. So 1.5 fingers of just retraction, opening. And I kind of went over this. I'm flying right through this information, but she had no mechanical changes to any movement prior to the retraction opening. So I sent her home with it, and I saw her the other day, and she was just dumbfounded with, she hadn't had, since that day, and she's been doing them about 4 or 5 times a day, she's had no pain. No pain with chewing gum, no pain with chewing steak, no pain with yawning. Done. All gone. Gone. To me, that's nuts, right? We have a slew of diagnoses from other medical professionals, which are either rare or not really backed up by any evidence, at least that they could find. They threw some stuff at her and said, maybe go see a dentist. All I simply did was take the time to look at her jaw. Her greatest limitation was in opening. I attacked opening, and it worked. Now, this isn't going to happen for everyone with TMJ. This isn't going to, please don't, this is not end all be all, but how amazing is it that, with no guidance, truly, I do not in any way by form consider myself a TMJ specialist or anyone who even remotely dabbles with it. If it comes across my path, I see if I can help, and then if I can, I move on. Because if I can't help you, if I don't feel confident with helping you, I'm going to get you to someone who I think is confident with helping you, as any proficient medical professional, regardless of field, should do. But I think that's nuts. Simply a combination of movements, and now all of her ear pain, jaw pain, totally gone. I think that's insane. And that's really the beauty of the assessment, is you can attack any joint and just follow the similar thought processes of repeated movements, of the types of influences that movement has on different classifications, whether that be dysfunction, derangement, posture, other. Irreducible, non-mechanical. At least you're sitting there trying to figure it out and assess it. And I think that's awesome. This woman thinks I'm like a genius for some reason, because her neck was the quickest extension responder you could be, and her jaw, similar similar effect. So she's going to be a patient for life, so check on that, right? But no, I mean, in all seriousness, that is insane that literally just simple movements and attacking her greatest limitation and all of her symptoms are gone. That's nuts. Now, there's really no research to support mechanical diagnosis and therapy in the jaw or in TMJ. I mean, there's none. There's really none out there. There's a case study or two, which I've come across before. I'm going to try and hunt down and attach that onto here. If it's not on here when you guys see the video, look within the next week. I'll try and post it to Facebook or the website. I'll really try and get it up before this is posted, but we'll see. It's, I think it's cool because there's no guidelines. So it's just attack and see what you can do, see what you can play with. I'm hoping, out there that there's going to be more research in the TMJ. I know this past year, some of the diplomats for the Institute went to, I think, the American Dental Association's big conference and spoke to why physical therapists, and in particular, McKenzie-type physical therapists, are, should be the go-to for people with TMJ-related disorders. I mean, maybe it's coming from the neck. Maybe a little bit, maybe they have associated headaches. At least we can help you figure out if it's mechanical or not. And that in the world in itself is beautiful. And if you've seen any of the previous videos, you know that I'm a big proponent of at least finding if that person is mechanical or not. So, again, this just hits like everything I've talked before. Everyone deserves the assessment. Everyone deserves your time and your effort to listen to them and just give it a shot. So hopefully I'll tag that on for here for you guys. I hope you learned something from this. Dabble. I mean, hey, dabble. That's really in the extremities. More research is coming out in the extremities. We're going to try and tag some as much as we can, as long as it's open to, to the public. But, just play. There's direction and preferences out there that no one knows of yet. And really, as long as you're not making them worse, or if you are going the opposite direction, go. Just see what you can find. I mean, that's the beauty of this system. And right now, the beauty of where we are in the system is that there's so much openness out there. That is awesome, because we could be finding direction and preferences in joints that no one even thought. So, well, my friends, I hope you learned something. Follow us on Facebook. Find us at our website. Please leave a comment if you enjoyed it. If you didn't, any questions or concerns, we'd love to hear from you. Move your patients early, move them often, and move them to end range, my friends, because that's where the magic happens. We look forward to seeing you next time. I'm the Millennial Mechanical Therapist. Have a good one.